We are back. We are back, joined by Sophia Moccio and Habrack, nurses at Robert Wood Johnson University Hospital in New Jersey. Thank you guys so much for coming on the show today.
Thank you
Thanks
for
for
having
having
us.
us.
Yeah, absolutely. I know Matt had you guys on Left Reckoning, and I did not realize how dang long the nurses have been on strike down in New Brunswick at Robert Wood Johnson. So how long have you been on strike at this point?
Today is day 83.
83.
Yeah,
Wow.
we've been
Wow.
out since August 4th.
Okay. And another thing I didn't realize, and I guess Sophia, I'll ask you about this. When you started striking, now it's over 80 days ago. By September 1st, the hospital retaliated against you by revoking your health insurance. Talk a bit about that.
So I'm actually fortunate. I'm 24, so I'm still on my parents' insurance, but everyone lost their insurance on September 1st. We all had to either elect to use the USW, United Steelworkers, which is our union's emergency assistance, or to elect to go on COBRA, which for families can be in the thousands and thousands of dollars a month.
I cannot believe that that's actually legal. That when you choose to strike, which is your right as workers, that the hospital is able to do that to people. Has there been any kind of movement on that front in terms of looking into the legality of this action by the hospital?
So as far as we're aware, like they are within their right to actually take our health insurance away, unfortunately.
It's insane.
I know, but it wasn't like a requirement. They decided that they were going to look at, the policy that says how many hours someone is before they're considered a full-time worker to qualify for insurance. And they're like, well, since you guys haven't been working, the past 3-4 weeks, you guys don't qualify actually. So that's just our policy. That's what they said.
It's also unprecedented. In the 2006 strike at Robert Wood, they were insured the whole time.
That's truly unbelievable. And I was going to kind of get to that, but after reading the article about you all in Jacobin, that retaliation just really stuck out to me as an especially disgusting thing for any company to do, but for a hospital to do in particular. And the fact that ostensibly the mission of the work that is done there is supposed to be to do no harm and to provide care for people, but not apparently for the workers there.
Yeah, it's really unfortunate because, our nurses, some of us have been working at the hospital for decades. We spend years and years taking care of the community and making sure that the community is healthy. And, if we are not able to make the hospital profit for 20 something days, all of a sudden our health just doesn't matter anymore. It's never about actually taking care of the nurses. It's about making sure that their bottom line is taken care of. As soon as we can't take care of that bottom line, it's like, screw you guys. Like, you don't deserve healthcare.
It really is very despicable. But I guess taking a few steps back to look at this from the big picture, Sophia, I'll ask you, what are the central demands of your strike? What were the conditions that led you all to making this decision for this very long strike that you're currently in the middle of?
The number one demand of our strike is for safe staffing in our contract. As it stands, we have safe staffing guidelines proposed by the hospital, but these are unenforceable in their very own contract because they include a caveat that if a nurse on a given unit calls out sick, that the adequate ratio of nurses to patients won't be provided because for whatever reason, nurses aren't allowed to be sick and aren't allowed to use their legally protected sick time. But we are asking for safe staffing ratios, which as evidence-based guideline provides for is that depending on the acuity or how sick a group of patients is, you need a specific number of nurses, and that differs from patient care area to patient care area. For instance, in the average med-surg unit on any Robert Wood medical surgical floor, they will have at least 6 nurses to 1 patient, and I have heard anecdotally that on night shift, sometimes it goes up to 7 or 8. We're asking for there to be 5 patients to 1 nurse so that we can better provide for our patient population, because We're a level 1 trauma center, which there are only 3 of in the state, in the most densely populated state in the nation. And we have really sick patients, and we can't provide adequate care to them with the current ratio that we have of nurses to patients.
And Erin, I mean, what is that like when there is not adequate staffing and you're dealing with in a trauma unit, working in a trauma unit where things are chaotic, ever kind of moving, difficult to predict, without that kind of redundancy, without that added labor force, it puts an even more undue burden on you all than even staffing shortages in other situations where nurses are working, which is also wrong. But this creates a level of intensity that I think is unique.
Yeah, so me and Sophia, we both work in the medical ICU. So a lot of the patients that we take care of are sedated on ventilators, or on life support medications. They require really a lot of the time, like minute by minute monitoring and adjustments to their treatment. We're listening for alarms. We're doing different things with and for the patients to help them recover. And, if we're not able to actually stay on top of that consistently, it can actually be a big medical emergency for someone. So in our ICU, we're supposed to have 2 patients for each nurse, but if there aren't enough nurses, some nurses may have 3 patients. And the more patients you add on, there's actually studies that show that there's a higher mortality rate per patient that the nurse is taking care of. The most recent study I saw was conducted in 2021 across like 86 hospitals, and it showed for each extra patient, mortality rates increased by 16%. And it's not just in the ICU. This is actually on med-surg floors. Our emergency room is very difficult because, like Sophia was saying, we're a level 1 trauma center. For anyone who doesn't know what that means, is that if a patient is too sick to be taken care of at a smaller community hospital, they'll actually be transferred to our facility for an escalation of care. So we actually get some of the sickest patients in the state, and we're asking to make sure that we're able to take care of our patients safely, because we care about our patients. We care about doing our jobs well. And, it kind of defeats the purpose of having this designated facility if they can't even provide the service that they're promising with it.
And you mentioned that you have safe staffing guidelines on the book, right? But clearly you are unable as a labor force to abide by those guidelines. So, Sophia, I mean, how do you get around because of the way that the hospital is choosing to cut back so much for profit on the labor force? How do you get around the guidelines that are supposed to be that you're supposed to abide by, but the corporate entity above you is choosing to not abide by?
Before we were in contract negotiations, we did not have anything in our contract that stipulated that we cannot truly go above a certain number of patients based on what the hospital has in terms of patient census. If they have 800 patients and 100 nurses, as if that was how it worked, if it was just all the patients are the same, all the nurses are the same, it would be 8 nurses to 1, or 8 patients to 1 nurse. Before any contract negotiations occurred, the units would often be understaffed. I worked in the trauma unit for almost 2 years, and before that I worked in the ER. So I've been at various levels of this hospital system and seen that no matter where you go, it is impossible to hold on to staff in a place where every day that you come into work, you are short-staffed and you're not going to be able to provide adequate care to your patients. And you have to make the decision between prioritizing one person's needs over another based on who is going to live or die based on what you get done that day, which is sickening. It is not how anybody wants to do their job, and it's not why anybody became a nurse.
Right. You became a nurse, obviously, to care for people, and the company is making that impossible, or, not the company, but the hospital itself. Erin, I'll turn to you here because there is a political solution at this point. I know that in the New Jersey state government, there has been legislation that would mandate certain staffing levels for nurses at hospitals in the state. I know that in California, there was a law that was passed to kind of protect nurses in that way. And only recently, I think in 2019, according to the Jacobin piece, did California kind of add on to those those staffing laws a way to penalize hospitals if they don't abide by them. New Jersey seemingly is behind the ball here on passing legislation on that front. Have you heard anything from Governor Phil Murphy's office? What are the political solutions here that you're hearing on the ground?
Yeah, so there's actually two bills that pertain to safe staffing that have actually just been sitting, going nowhere for almost 20 years now. So through our strike, we're trying to get these same kind of guidelines and policies put in place that would be comparable to what California has by law. But our bigger goal is that we would like to see this extended out to the state level. So we have been actually trying to call politicians and talk to our state legislators about getting these bills passed. Unfortunately, Governor Murphy has been kind of sitting on the fence, to put it lightly, between our union and the hospital. It's kind of sad because Robert Wood Johnson is the largest private employer in the state. So, and beyond that, I mean, most of the population of the state is going to be serviced by Robert Wood Johnson Hospital, So these decisions are being made that really affect like public health for most of New Jersey residents. And they're being made by people who are not elected officials. These are people that climbed a corporate ladder and now they get to decide how healthcare is carried out for millions of people. We really would like to see these bills pushed through, because even beyond our hospital system, I think it's really vital, even nationwide, to have enforceable staffing ratios. When it comes to enforceability with penalties in place, the reason we say enforceable is because the hospital actually has a financial incentive to keep us short-staffed.
Yeah.
They make more money with the less employees that they have to pay. Like, it's common sense.
I mean, we see this across different sectors. We see it in, when you have these consulting companies come in and they say, well, how can you make some more money here for the C-suite? And it's always cutting labor because that's the easiest thing to do, reducing redundancy, but creating a more like inefficient product. And that's just talking about standard corporations. This is about people's care and lives here. Sophia, I wanted to ask you because, Robert Wood Johnson, I'm from New Jersey. It has a place in the community. People know of Robert Wood Johnson. It's a large institution. Can you talk about kind of that lack of respect from the top down about Robert Wood Johnson's place as a hospital and medical center in the state of New Jersey?
Absolutely. I grew up 10 minutes away from Robert Wood. My dad was a Rutgers professor. I went to Rutgers. I lived in New Brunswick before I grew up in the general area in Middlesex County. And the hospital is a huge, all-encompassing facility that has taken over much of the city. New Brunswick is actually nicknamed the healthcare city as a result, because there are two major hospitals in the area, and they have a partnership with not only the medical school at Rutgers, but the nursing school where I went at Rutgers. Mm-hmm. They're all connected. They're all related to one another. It is highly revered as one of the best hospitals you can work at for a long time. And when I was young, all I wanted to do was be a nurse. All I wanted to do was work at Robert Wood. It was the dream. And everyone talked about it like it was the greatest hospital that you could possibly work at. It has fallen from grace for so many people because of the inability to hold on to staff and to provide staff with fair rights in terms of, can I take care of my patient assignment? Can I make sure I'm providing adequate care for the people that I'm supposed to care for? Can I take a break that day? Can I eat lunch that day? There are so many ways in which the facility has changed over the past couple of years, but the most notable one is that people who work there for 30, 40 years have left in droves, especially with COVID, because it has just been obvious that there is no way to prioritize the nurses and the staff when you cut costs at every corner and you make it impossible to do your job to the utmost of your ability with low staffing, no supplies, and no support.
Well, Aaron and Sophia, how can people help in the midst of this very long strike that you all are holding firm on?
Sure. So we do have social media accounts that we're asking people to follow as RWJ Nurses United on Instagram and Facebook. We are also in the beginning phases of forming a coalition with different community organizations and other nursing unions and just other nurses in general across the state. So we set up a website for that. It's safestaffingnj.org. Pretty much the goal of this coalition is to try and get these bills passed at the state level so that nurses and patients in the entire state of New Jersey will be protected beyond our contract fight. This fight has to keep going.
Well, we will put a link to all of those resources and those accounts in the description wherever people are listening to this or watching. Thank you guys so much for coming on the show today and taking your time to speak to us about this. I really appreciate it.
Thank you so much for having us.
Sure.